Thanks for listening to part 2 of my conversation with Dr. Ming Wang of the Wang Foundation for Sight Restoration. In this next episode, Dr. Wang discusses his 7 measures again, and particularly those that we need to learn or consider: volunteer testing and the new, much higher, more stringent level of anti-infection protocol.
Which is even better than nasal swab in terms of, the uncomfortableness for patients. So basically, the bottom line for these tests is that technology is pretty much very close to be there with reasonably high rate of specificity and sensitivity. However, the bottleneck is the number of humans needs to be involved, the funding from federal government to set up those testing facilities, and the reagents, the manufacturing of reagents, and the availability of nasal swab itself are behind.
Yeah. Oh, I'm sure that the people that just had the nasal swab are really happy to hear that any minute now we're going to have a test where they just have to spit.
Yes.
So,
yes,
let's go. I like you had a really cool idea, and that is this voluntary testing, maybe an encouraged voluntary testing, right? With a little bit of tell me about how you would roll that out, or how you see that happening.
Yeah, so far we covered 3 out of my 7 measures to prevent second outbreak in America when we reopen. First, again, open business slowly, gradually, high priority first, test every body temperature when you're entering. Second is in the early to open businesses, try to test everyone in terms of providers. And third is bring back those already immune first to work. And number 4 is what you just mentioned, voluntary testing. If, as a big if our government get their preparation pushed hard right now in April, which are not pushing that hard because there are even people who think we need to test less, which is ridiculous. We have to test more, a lot more, as we open the nation. So that's why I'm enthusiastic promoting my 7 measures, because most people don't know. I mean, you watch the airwaves. It's a minority of this airwave will be clearly spell out the 7 measures. Why? He said, why? It's because America has always been the strongest nation on this planet. As the strongest nation with the best healthcare system, you know what? We build complacency. We don't want to learn as Americans from other countries.
It's like we want to experience it ourselves, and any of the data that we hear from somebody else, we turn the alarm off and go, well, until it happens to us, we'll tell you if we believe it, right?
Yeah. I mean, part of the reason that CDC was so poorly prepared for even testing. I mean, there's no excuse not ready for testing in early March. And I understand in February, March, you don't need to disturb the American public, scare them. But you know why it's not prepared? It's because we feel, this virus is not going to come here. It's not going to come here as bad, and we don't need to learn from other countries. We, as the strongest nation on the planet, we're not going to remain that way unless in the 21st century, we're wanting to learn from others.
Absolutely.
And I'm unique because I have this information from the other countries. I'm somewhat the lonely voice now in terms of this preparation in April.
Yep.
I mean, you don't hear this preparation in April that I'm advocating now.
No, I would say, and that's one of the reasons I wanted to talk with you, because I feel like you're a bit of a lone candle in the wind, and we don't want that candle to be blown out when it's, So on this voluntary testing, would you see that being more like voting? Or would you see it more like the flu shot? Hey, we encourage it. Go get your flu shot. Or, hey, this is the day, or this is the week. People need to go. It is your fundamental responsibility. You need to vote. You need to be tested. What would you see?
Yeah. I would say, this is a big if we have a testing facility catching up, which, as I said, it's big if. But if we are, I don't think differentiate the grade should not be a mandatory or required, just encouraged. Again, could be like from voting to flu shot, any shades of gray, but also that's dictated by where we as a nation, right? If when the test kits become available, we're going to advocate voluntary testing and such. Depends on the availability and also how bad it is then. Because if the number of new cases is very small, we don't need to really strongly nudging people. We can just kind of more relaxed voluntary, so to speak. If a lot of new cases, we kind of need to nudge. So it depends on the viral situation. But It's voluntary. That's what I'm advocating, and we should encourage it. And everybody wear a little, pad. And I was tested, like I voted. But number four, so that's number four. Number five is my main at the heart of my 7 measure suggestions. Required testing in high risk facilities, in high risk professionals, because 4,500 nursing homes. Of the death of the United States, right? A big portion has to do with nursing home death. Okay, it's like 7,000 die from nursing home alone. So what I'm trying to say is that this is very high risk, right? Elderly medical, right? The 80% of the deaths occur in patients over age 55 right now. So those, I would say, that you got little citizen, individual rights, but I think that's just kind of tone it down on that you're such a potential high risk facility, nursing home, medical hospitals, prisons should be required testing.
Yeah,
okay?
the data,
Provide,
if you really go back rather than to just speculation, the data suggests very strongly that these people need it. You can say, it is a balance of civil liberties and this, but on the other hand, are you saying, well, geez, but if we're just not going to test them because we don't want to step on their toes, but now they have, a ridiculously unconscionable high risk of dying. I think in that risk benefit ratio, people would say, for a simple saliva test, which you're now mentioning may be available soon, this is a very sane and good way to preserve life for loved ones that we have. Yeah.
Yeah, and I think government should provide that. Government should provide, you have X number of staff, let's say once a month or once every 2 weeks or something, should provide that. And I think if I have a good talk with my staff, I have just spit of saliva, and probably 100% will go with it, right? Why not? Right? And for their own peace of mind, for their own family, it's not just for their service to the patient. They're going to be counted 100 of them a day. It's for their own family. They want to know. Right?
That's right.
Think about it. One of your nurse, one of your technicians is going to come in contact 20, 30, 40, 50 people a day. So every day he or she walks home is actually bringing a risk home.
Right.
Right? Yep. Because he or she because his or her mom, the dad, is going to be, he or she may not have a problem. The young technician may not have a problem, but his or her son and mother may die because he or she bring back the virus from the clinic, okay? Or whatever. So what I'm trying to say is it's so important that I think with the spit saliva test, that for high-risk facilities, the high-risk professionals, I would say vast majority will take the test. A little bit individualized spit and saliva is no big loss of individual right as such. Right. So that is my core part of my 7 measure recommendation. Number 5 is required testing.
On that issue, people are going to debate, should that be a federal government responsibility, a state government responsibility, private health insurance, or the patient, or some combination of that? I heard you say, I really think that should be a government-funded process.
Yes. Or at least inexpensively, like all of us can provide for a flu shot. When a flu shot come down, we as a clinic, small business owner have to pay something. I think whatever, $30 a shot or something. Yeah. And we will do it. Some companies, but the point is that since you asked about cost, compare with the cost not doing that. Second way, even more deadly, is no comparison. Mm-hmm. It's no comparison. Okay.
Mm-hmm. Right.
So, and so that's the thing is this advocation of required testing in high-risk professionals and high-risk facility is not underlined, not shared by most of these people, most of this media and stuff. So I'm a somewhat lonely voice. That's why I'm communicating to as many people to talk to, because I have this direct line every evening, every night. I'm communicating with through WeChat, my Chinese colleagues, the South Korean colleagues, Japanese colleagues, Hong Kong colleagues. So I don't have that problem learning from other countries. I'm even from the other countries, So I don't have that complacing or superiority or we're Americans and nothing learned from the rest of the world. So I'm more eager to learn because that will be good for us,
Yeah, exactly.
I just hope more people will hear this perspective, which is somewhat unique. And so that's number 5. Number 6 is maintain social distancing. Lots of people think, oh, once we reopen in May, no. When we reopen in May, the risk of infection for the public, this is the key, is more than early March, not less. Early March.
I think that would surprise a lot of people, wouldn't it?
Yeah.
Yep.
Yeah. They think we passed this, but my entire 7 measures of foundational concept is early March. We mid-March. Oh, we should the clinic, should I wear the mask? It's a small number still. It's only from West Coast, Seattle, whatever. But this reopening is we're releasing up to 5 million infected Americans, silent carriers, most of them from their confinement of home, back out into the open society. We are starting with a bigger base right now.
Mm-hmm.
The risk of mass infection is even higher, not lower.
So how are the countries that you talk to, for instance, how is China handling that at this point, since they are a few months ahead of us? How are they handling social distancing there and in Hong Kong?
Okay, so that's my number 6, is continue maintain social distancing, continue wear masks after the outbreak for many, many months, okay? Perhaps for a year or 2, depends on when the vaccination becomes available, and continue avoiding crowded areas in closed space with lots of people. That is going to be the biggest challenge because there are people right now at the height of our outbreak. We're at the height. United States peaking, new case, mid-April. Death peaking at the end of April. So there are 2 kinds of peaks, okay? Because death is the lag in time.
Yep.
New case about 2 to 3 weeks. So if there are people right now don't want to stay home at the height of the outbreak right now in the United States, mid-April, they are protesting. They don't want to stay home. Watching the news yesterday, lots of people, of course, already were. Anybody with medical knowledge would be very worried.
Mm-hmm.
You're out. You're destroying all the. People don't understand when they go out hugging as a group, sounding horns, touching each other. It's not about them. They may be willing to die, but it's about all the rest of us.
The rest of us, yeah.
Because they just keep the transmission alive among them.
Yep.
Which will eventually hurt us. So that's the totally selfish behavior.
Yes.
Okay.
Without a doubt.
But not only that. Here's my main worry. If significant of Americans so lack of information and knowledge about this, and they were even against social distancing at the height of outbreak. Can you imagine when outbreak passed, when the second wave is about to come, they were absolutely against any social distancing or any mask.
Absolutely, because number 1, they may be asymptomatic. Number 2, they're not seeing their friends having problems. Number 3, they're starting to enjoy life again, and they go, darn it, I don't want to return back to those days again. That was a pain in the rear end, and I don't want to have that.
Exactly. Yeah.
And when's baseball season starting? I want to go to a game, right?
No. So what I'm worried about is here in America, we're going to have a tremendous public educational challenge. How to educate, because I believe these folks are not crazy. They just don't have the medical knowledge. They don't have opportunity to sit down with me, like somebody like me and you, and talk about this, okay? And they don't have the information outside China, outside the United States, right? So that I think it's just lack of knowledge, right? But what I'm worried about, if public education does not catch up, when we reopen, the same group of people, and even more, they'll be even less willing to do the social distancing. Because they think we're open.
And I think that presents a tremendous challenge for another reason, I believe, Ming, and that is we see such a polarized base, if you will, that we've got people that don't trust the media at all. We've got people that don't trust the president at all. We've got people that don't trust the Democrats at all. So, but each of those groups have their own group that they need to educate for those that do trust them. And so what you're talking about is having to bring each of these groups in unison to talk the same language, aligned to their constituency that you may not trust that guy over there and what he's saying, but trust us. This is a big deal, and be delivering a continuous and consistent message to the public to educate them. That is a big task.
Absolutely. You're going after my heart, so to speak, Jeff. This is what I see. I published an article in Tennessee about 2 weeks ago. Coronavirus outbreak review the need for common ground. Our country, society is so polarized. The social atmosphere is toxic. People don't care about the marital issue anymore. They only care about power alliances. Right? That civil discourse without insulting your opponent is becoming increasingly rare. I'm from China, from suffering cultural revolution. I had no freedom. I came to this country as a poor student, $50 many years ago.
Mm-hmm.
One of the things that impressed me the most when I landed in this country is the same. Say, I may not agree with what you say, but I will defend to my death your right to see it. To me, someone escaping communist persecution and the cultural revolution, such a breath of fresh air.
Right.
I fell in love with America because of the freedom and mutual respect.
Mm-hmm.
But we are going away from that as a nation. We are fixating our differences rather than appreciating what we have in common. Now the wake-up call came, the virus, right? We realize that we are so unprepared, not in the habit of overcoming polarization to find a common ground, to come together as a nation. So that's why my article wrote 2 weeks ago. I said we have to learn how to find common ground in peacetime, so to speak. Without crisis, how do you listen to an opponent? How do you resolve the gridlock, which is the characteristic of national discourse now? But interestingly, in this viral crisis, we have found a common ground.
Yeah, it's very interesting, isn't it? In the middle of a crisis, it may be what we very much needed to come back to what really counts, and that is, being together. Exactly.
We are all vulnerable.
Yeah.
We have no choice but to find a way together.
Yeah.
So that's why actually, Jeff and I formed a nonprofit organization called Common Ground Network, which is specific mission, which is my life's calling now. That was in my life. That's my focus.
Mm-hmm.
Beyond medicine is to help people find a way to how to find common ground, so they can resolve their differences and being able to solve the problem in their life, become more successful and happier.
Well, wait a minute, Ming. Ming, are you saying that you and I could actually disagree and still respect each other? Holy cow, that's a radical thought.
Yeah, it's very radical these days. You're absolutely right. But
I laugh only because I want to cry otherwise, because anyway, that's really great. Hey, in the interest of time, and again, I could talk to you all the time. We'll probably talk separately on this, but let's get to your number 7, which might be one of the more controversial suggestions, given that we live in a very don't tread on me society. Tell me about how do we know where people are that have it and don't?
Yeah. Number 7 is the digital contact tracing. First of all, good news that Google and Apple, two arch rivals on cell phone, decided to overcome the differences, find a common ground to work together on cell phone technology, which is wonderful. Second, of course, we are different. We are not China. We are not other countries. But remarkably, South Korea is democratic society. Japan is. So they are implementing digital contact tracing as such. And but we need to respect our country, the privacy and individual rights of citizens. However, here's the thing. I really believe technology can be developed without stepping on the privacy and individual rights. I will give you a fascinating example, Jeff, that the technology or contact tracing technology is essentially working with none of us having any trouble in America. Here's an example. Not to quite a degree, but it's the same backbone technology. When you drive home today and say we go to work, and it's a traffic jam, you have two kinds of GPS. One regular GPS, one is smartphone GPS, right? Smart GPS will actually give you a red area of one particular section of highway which is congested, right? Yep. So how does it get that? It gets that from GPS, tracking every single cell phone in that part of the road. They see more high density of cell phones in that section of the road. That's how it can figure out that part is congested. Complete cell phone based treatment.
Very interesting, but nobody feels like they only feel that that's a benefit to them rather than something that you're treading on my rights, right?
Exactly. So what's going to happen if you do it right? This is going to happen. you have a cell phone, Jeff. You're going to have a daily notice of last 2 weeks that people you have in contact who turn out to be COVID-19 positive. It will not tell you who they are.
Mm-hmm.
It just say within 6 feet in the last 2 weeks, just based on the same the traffic jam type of testing. It's the technology all there to tell you that how many people. Now, number one, you don't know who they are, so their privacy is protected, and nobody will know the information you get either.
Gotcha.
I mean, for example, when you sit in the car, does anybody on the planet know Dr. Jeff Kegarise is getting information in his smartphone, a particular traffic jam 1 mile in front of him? Nobody knows that.
Nope.
Nobody knows you get that information. Nor do you know who are these people in that section of the highway.
That's right.
So both will be protected. Now,
let me ask on that. Do you think that somebody could say yes, but if you can do that with a collective group of cell phones, could you do that with individual cell phones to the point that I could say, I'm going to go to Starbucks, let me look and see if there are any red patrons there, kind of the scarlet letter.
Exactly.
I can't go because there's an infected person.
Yeah, exactly. Now, then it is, first of all, you don't know who they are. You don't really need to know who they are. You just need to know where they are, right? And they don't know who you are, and that's the GPS example I demonstrated. And then you make a decision. You say, okay, in the last 2 weeks, within 6 feet, I have 3 contacts. Okay? Then you decide if you want to get tested. It's completely up to you. For people like you and me, healthcare workers, we have a little more knowledge, education. We say, you know what? If it's even one person, I'm going to get my saliva spit out. Okay? I tested 2 weeks ago. It was negative, but doesn't mean in the last 2 weeks I already have one contact based on my cell phone, based on my GPS, congested, smart GPS. I'm just going to get tested. But another person say, I'm not bothered. I'm going to wait, maybe get at least 5 people in the last 2 weeks. If I can't do it within 6 feet out there. So everybody has the right to decide, but you get the information.
So it's knowledge is power. Right now I don't know, but if I did have a little more knowledge, I could make my own decision then at that point. But it is saying it's knowledge for me about me, not so much knowledge about Cole, who's sitting here in the studio with me. Does he have a red indicator on his head because he has it and I want to stay away from him? I wouldn't know that. I would just...
No. The technology can be developed to know that, but what I'm trying to say is that it can be configured. You wouldn't know that.
Right.
Okay? Because there's certain way. There are tons of examples in digital electronic technology. The information is available, but there can be control. For example, if you break into Facebook headquarters, you can actually find out, let's say, whatever those Google, whatever. In fact, there's one person who mass killed some people in California 2 years ago, and his iPhone. There's debate whether there's a killer's iPhone should be unlocked, right? So blah blah blah. But what I'm trying to say is that my point is that you see, none of us except Apple company itself can unlock the cell phone or the cell phone digital data, right? So what I'm trying to say is information can be controlled such as that, not available to all of us.
Right. It's like anything in technology in that you look at all the advantages. You can always say, yes, but what if? And you can find some outlying type of thing where somebody that has a bad intention could potentially do that. We've got a lot of those examples now, but we still say, I wouldn't do without the internet though, right?
Exactly. So for example, the iPhone company can actually unlock and actually literally know what you have typed in your iPhone, I have done in the last 24 hours, whatever, right? But just because of that, did that scare you not to use cell phone? No, because we feel reasonably confident that iPhone, the Apple will lock that information not available to most of the public. So I'm looking at that kind of guidance. So, but here's the problem. Very interesting question, right? You say, Dr. Wang, you're not a computer engineer. You're just ophthalmologist. So if you can achieve this level of understanding, which is very logical, reasonable, and of course, large section of population of engineers and so on, no, right? Why such a seemingly no solution can be found polarization? My answer is very simple. That is the whole toxic atmosphere of our country. People don't care about marriage issue, only care about polarization. They don't want to know They just want to stick to their left or right or whatever the corner. They just want, because polarization gives people power, and all they care is power.
Yeah.
But this virus woke us up.
This virus proves to us that we truly are powerless, and potentially even more powerless as a potential second wave comes on. If you're just joining us, I've been talking with Dr. Ming Wang, a fascinating conversation looking at not just the first wave of coronavirus, but the potential second wave that could be even more devastating if it occurs like it has in past pandemics. And as we start to migrate back to work, Dr. Wang has been publicly, as I mentioned, maybe a lone candle in the wind saying, hey guys, don't just jump back immediately. Let's take precautions now so that we can all be safer for a long period of time, save an awful lot of lives, and not look back and go, boy, I wish in April or even early May we had done this. So Dr. Wang has many degrees, many interests. You know a lot about him. He's an outstanding ophthalmic surgeon here in Nashville, Tennessee. He's an innovator, but he's also a person concerned not only about his patients and the quality of surgery, but the quality of life here in the United States. And he has a unique perspective in that he has come from a communist country in the past, migrated here, maybe more than most of us who were born here. Fortunately, he appreciates the luxuries and the freedoms that we have, and now sees that those things need to come together in a positive way to fight this virus as a community. I want to end with one question because I want to bring it back to eyes, Dr. Wang. There's a lot of elective surgery that has been postponed, moved back, etc. You mentioned in your 7 methods or your 7 recommendations, one of those, of course, is to have all healthcare workers tested. Do you feel like in May, reasonably speaking, people could, if with the appropriate testing and temperatures, people could have safe ophthalmic surgery and other elective surgeries in ambulatory surgery centers? Or are we going to need to wait longer?
Yes, but again, there's an assumption that the continue coming down in the peak, and hopefully by early May, we are way down on the downside of the curve, and the new case is definitely drastically down. New case, even though death rate, as I said, peak 2 weeks later, is still somewhat high, but understandable that will come down as the new case come down ahead by 2 weeks or so. I look at the ophthalmic surgery should come back, including elective surgeries, but it will be an entirely new setting. That is a strict adherence of social distancing policy, gloves, gowns, and sterilization. For example, at a surgery center, we are implementing measures that the families never come back to the post-op area, ever.
Yeah.
Ever. Things like that, because these are all bring additional asymptomatic carrier chance in that, and the surgery has to be scheduled certain distance apart. The waiting room should have certain maximum number can be in there. I advocate required testing for all healthcare workers, including our staff. So give our patient peace of mind, and also we check every patient before they come in, whether in a 24-hour ahead appointment, reminding whether they have fever, coughing, or any contact with any COVID-19 last 22 weeks, they should not be coming into the facility. And everybody come into the facility will have temperature checked. Anybody who is found coughing or anything should be immediately sent home. So it's a new, much higher level of anti-infective protocol stringency. And with that setting, with the anticipated continued downgoing of the pie, we should be able to come back for important business such as medical practice and things like that with a strict adherence of all that. But my main point is these 7 measures that we have to learn. As Americans, we have to learn. We learned one lesson, very bad, a very important lesson first time around, is that we mistakenly thought that was affecting the Asian countries, the virus would not come here. And don't believe that. We cannot get burned again.
We can't be so ethnocentric that we only wait for the data to hit us before we start looking at the future. So listen, Ming, I really, really appreciate you spending as much time as you have with us. This is fascinating knowledge. and it needs to be heard. It needs to be discussed. There's a part of me that says both I'm appreciative and I hope you are so wrong that we come back and we go,
Yeah.
none of that happened. But you know what? That would be much, much better. So what I'd like to do is I really would like more, because we learn so much about this nearly every day, every week. I'd like to kind of revisit in about 2 or 3 months, because my sense is we're not going to say, oh, look back. We're going to say, hey, we're in a different phase, just like you're saying. And how are we doing? Did we prepare in some ways well enough? And so that we can, again, have a conversation like this and see what we're doing at that point, and maybe perhaps get your guidance on what you think we ought to do sometime maybe in June or July, if that makes sense with you. I'd love to talk with you again.
Yes, I would be love to, and also even in April, if Jeff, your church or Rotary Club or Chamber of Commerce, any organization, I want to talk every day right now in April. It's such a critical educational process. We have to be prepared now to do what we need to do after May. So I would love to, like webinar format. I do 3 or 4 webinars a day right now. And so if you know any organization, let me know. And my staff, Alana, can set it up. There's no cost.
We will do that. And on a personal note, as I consider you a friend, somebody I admire as a surgeon, as a person, as a business leader, as a community leader, I really appreciate that. And on a very individual basis, I appreciate for our shared patients that we share in surgical care. I appreciate that all that you do to give our patients more than just good eye care, but a great patient experience. And so thank you very much for sharing your wisdom today, your insight, and your recommendations, Dr. Wang.
Thank you, Jeff. Appreciate it.
Okay.